with Dr. Levin down in Los Gatos, California. Dr. Levin is an orthopedic surgeon who's been using the GlideTrak equipment for some time. Good morning, Dr. Levin.
Good morning. How are you doing today?
Wonderful. It's good to be down here with you for the express purposes of getting some feedback from you on the applications of the GlideTrak and GlideCycle equipment to your client personnel. How has it been using it down here?
Well, we've used it in several different modalities. What I like especially is the GlideTrak, because that can get people who are rehabilitating up, walking, using their muscles, increasing the range of motion of their hips and knees much faster than they would when they're in the parallel bars or in a walker. People who've had fractured hips, total hips, knee replacements, fractures of the tibiae or femur that can't put full weight bearing, are able to get up vertical, move the joints, and extend the joints completely, and also completely exercise the muscles. Usually we have difficulty getting all this motion in people who have these injuries or these surgical procedures, and it takes a long time. And on the GlideCycle, for those people who have graduated and able to work out in a GlideCycle, you increase the range of motion of your joints, especially the hip extensions, knee extension, that you don't get when you run and you don't get when you bicycle. And it also increases the muscles that are involved fully. The quadriceps, the hamstrings, the anterior tibialis really gets a workout that you usually don't get a workout with these other modalities. So for increasing the muscle strength a little differently than these other modalities like bicycles or running or the elliptical, it's a great advantage and a great cross trainer for these athletes.
And you say that from personal experiences. You're a glide cyclist yourself now with some many miles under your belt.
Well, I'd run for 40 years, and there came a time that I couldn't run anymore, and I think it was the jarring. And I'd stopped running for a couple years until I found the GlideCycle. And the most I could do it was a mile before I had to quit, and now with the GlideCycle I can do 5 miles without too much trouble. And there are a lot of people that I've come across that are burnt out runners for one reason or another. Their knees are bad, or their hips are bad, or they just can't take the jarring. And if they get on the GlideCycle, they'll find that they can go back to the sport that they love, get the exercise that they need, and really move those joints the way they should be moving.
Excellent. Let's talk about some specific environmental applications. For example, we have the GlideTrak in a couple of physical therapy centers that you work with. How do you find the GlideTrak fits into their client population?
Well, it's been used extensively, and it fits in very, very well. As I said before, there are people that have trouble putting full weight on their joints, either for pain or with restrictions from the physicians. And here we can get the people up, exercise the muscles, increase the range of motion of the joints without harming the bones or the joints, and keeping the pain factor down considerably.
Good. And then what kind of people are we talking about here? Young people from school, sports programs, or regular folks from the community that have just had surgeries, or the whole range, or how do you feel? It's
the whole range. We can take people who have had fractured hips, elderly in their 70s, 80s, 90s, and get them up on the GlideTrak and get them moving. And of course the younger individuals, teenagers, who've had significant injuries, a lot of sports injuries. When you have ligament reconstructions, you don't want to put too much stress on those ligaments, but you want to get the muscles and the joints moving, and this is an excellent way of doing it. So there's a whole range of application for this technique.
Well, Dr. Levin, we know that what the GlideTrak can do in terms of lifting people's body weight by their pelvis, and it's available on the videos on the website, but there's other products that do this, possibly the Alter G system for $25,000 or $70,000, or the Lightgate system, which uses the harness system, all of which are available to be seen on the internet, and they're good products with their applications. How does the GlideTrak stack up to those, as well as the normal parallel bars or walkers that are used to accomplish what we're accomplishing now?
Well, the other devices are extremely expensive compared to the GlideTrak. They're between 15 times more, some of them. And the other factor is that they're relatively clumsy to use. One of the contraptions uses air pressure, but you can't get into the legs, you can't see what's going on, and you can't get around to the individual as well to see exactly how the joints are moving. The seat that the GlideTrak has puts the pressure where it's supposed to be on the ischium, as you would sit, but it allows significant motion of the hips and knees, and some of the other applications don't. Some use harnesses that compress the abdomen too much and are quite uncomfortable. And the GlideTrak has a system of safety. If you put a shoulder strap around the individuals, especially for the elderly, you can prevent falls as they're exercising. So all in all, I think the GlideTrak has many more applications, easier to use, much less expensive, and the therapist is able to get to the lower extremity for whatever reason they would have to get to the lower extremity to help straighten out the leg, or for whatever they have to evaluate.
Well, that's very, very exciting. And a lot of therapy centers currently use parallel bars and walkers to adjust their patients to unweighted movement, to gain the movement and practice the movement again. Those have been tried and true methods. The GlideTrak is potentially more applicable to those candidates. Is that correct?
I believe so, because these people, when they're on the walker or on the parallel bars, they're having to hold themselves up with their arms, and a lot of people don't have the arm strength to do this, especially the obese that we didn't talk about before, that they can't exercise, and they have trouble just getting their own body weight up on crutches or a walker, so they can't function. They're always in a wheelchair. And for those people, the GlideTrak is excellent because it gets them up, it takes their body weight off their lower extremities. You're not worried about them inadvertently putting too much weight on an extremity that you have when the people are in parallel bars. And the fatigue factor comes into play with the parallel bars and with the walker. But if you're tired and in the GlideTrak, you just stop.
Yeah.
You aren't doing any weight bearing.
Oh, that's excellent. That really is. And then I was going to ask you about the non-weight-bearing practice that people do in swimming pools for the same kind of therapy on your surgeries or post-surgery. How does that stack up?
Well, the swimming pools are an excellent way of taking weight off and getting motion. But then again, it's cumbersome. You have to get into the swimming pool again. It feels good. The water is warm usually. I think that's an excellent method, but I don't think that you really get the full range of motion that you can get in the GlideTrak. In the GlideTrak, the therapist is right there to encourage the patient for full range of motion and for more strengthening exercises.
Great. Did you find the GlideTrak obtrusive to the therapy environment? I mean, does it take up a lot of space? Is it in the way? Or
No, the GlideTrak fits quite easily over the treadmill. And it fits right in with all the other equipment that's in most physical therapy units.
Well, fantastic. Dr. Levin, thank you for spending a little bit of time with us here. And I ask you just maybe one final question, and that would be sort of a summary. Is there anything that you would like to say to direct a thought to any therapy or orthopedic physicians or anyone regarding, say, neural rehab or any other subject?
I just believe that this is an excellent method of increasing motion, increasing strength, and it helps people psychologically because they're up and vertical and actually moving. So there are a million different applications, and I feel that it really has an excellent place in our rehabilitative therapy.
Well, thank you so much for chatting with us today. And I know you're really busy, so we'll let you get back to work.
Thank you.
All right. Bye-bye.